Okay, so we have Ronnie today. He stepped in a gopher hole 2 days ago and sprained his ankle. There's no fracture, but there's quite a bit of swelling and bruising and tenderness. So Ronnie is in the acute inflammation stage of healing. This stage usually lasts 2 to 4 days, and this is when he's experiencing vascular reactions and leukocytes have been phagocytizing extra debris. So some indications of why we would want to use ultrasound on this patient would be that it helps for the treatment of soft tissue acute dysfunction. And also it enhances soft tissue and bone healing. Some contraindications or reasons we wouldn't want to use ultrasound on this patient include impaired pain and temperature sensation, as well as impaired circulation. Since Ronnie has a history of diabetes, I would want to make sure to check these things before I start ultrasound. So I will check the sensation around his feet and around the wound and make sure the circulation is good. You wouldn't want to put the ultrasound on somebody with history of blood clots or deep vein thrombosis, which Ronnie's intake form says that he does not have. You would not want to do ultrasound over malignancies, so I will make sure to check the skin for that as well. In addition, you don't want to do ultrasound on the trunk or neck of somebody with a pacemaker, which Ronnie does have a pacemaker, but since we were working on his ankle, we should be fine there. So let's go see how Ronnie is. Ronnie, how you doing?
Pretty good.
All right. I understand you rolled your ankle, huh?
Yeah.
Feeling a little tender?
Yep.
Sore? Okay. So what I would like to do is put some ultrasound on the ankle. So that basically I'm going to put some gel on your ankle and just wave a wand around and kind of push the gel around. And it's essentially just to stimulate tissue regeneration and kind of help that ankle to start healing better.
Okay.
That sound good?
Yeah.
All right. Perfect. So I'm just going to come down here and I'm going to just check out a few things before we start. So I'm just going to make sure you feel all my touches, okay? You feel that?
Yeah.
Pretty tender there?
Yeah.
You feel those?
Yep.
How about this?
Yep.
Over here?
Yep.
And we got down on the feet here.
Yeah.
Feel all those?
Yeah.
All right, perfect. Circulation looks good. You feel everything. Everything else on the skin looks good. So for this treatment, you shouldn't feel any pain, discomfort, or burning. Please let me know if you do and we'll stop the treatment. But that's not the purpose of this at all. It should basically just feel like I'm rubbing some cold gel on your ankle. Okay? So I'm going to set my parameters here. I'm going to go to ultrasound. Probably go up to 10 minutes. We want 3 megahertz since the tissue is superficial. We're going to do a 50% duty cycle so we don't have any thermal effects since it's acute. And then we're going to do 0.5 intensity. So I'm just going to squirt some gel on your leg here, Ronnie. It might be a little cold. Sorry about that. All right. Next what I'm going to do is I'm going to put the wand in the gel. And I'm going to be able to start it. There we go. So I'm going to want to move the head of the ultrasound wand 2 to 3 times the size of the actual head. Otherwise, the area gets too large and it won't effectively treat the tissues. Ronnie, is this feeling okay?
Yeah, I don't feel much, just the gel.
Okay, perfect. All right, so 10 minutes has gone by. We'll make sure to stop the machine before taking it off. How'd that feel? Not too bad?
Yeah, it was pretty good.
Still feeling okay?
Yep.
All right, perfect. I'm just gonna wipe this gel off you.
Thank you.
And there we go. That was our ultrasound treatment.